Good morning, ladies and gentlemen. My name is Richard Mongai from Zamara. Thank you so much for making time to be with us this morning. It's 10 o'clock on the 8th of May. From where I'm seated, the weather is looking brilliant. It's sunny outside. There's a bit of gray, but it's still very bright. And we're looking forward to having an amazing 1 hour session with an amazing doctor. We are going to be talking about the myths and misconceptions regarding COVID 19. Our doctor today is going to be Dr. Amadi, like you see on the poster, Zamara Talks. This is one of the webinars that we shall be hosting. We have had a one, and we shall continue having many in the near weeks to come, in the near future to come. Dr. Amadi is a doctor with a vast experience in clinical practice, in aviation medicine, in mental wellness, and he's worked in many institutions in private and public sectors. He's very passionate about bridging the gap in accessing healthcare. Now, he has many accolades attached to his name. He's not only an MBCHB, meaning that he's done a degree in medicine and surgery, but he has a master's in public health from London, UK. He has a certificate in project management from Washington University in USA, and he's currently pursuing a master's of medicine in psychiatry. So he's an all-rounded, an amazing speaker we have today, and we look forward to demystifying all these issues regarding COVID-19. So welcome, Dr. Amadi.
Thank you. Thank you so much, Richard. Thank you.
And Dr.
Yes.
Even as we begin this very interesting topic,
Uh-huh.
I don't know about the rest of you, but I've noticed that life is almost turning into normal. People are getting back to their offices, people are going back to work, traffic is back to normal hectic. I don't know, Dr. What do you think about this situation?
Well. Indeed, people seems as though they are going back to their daily routines, as it were. And given that we in a lockdown per se within Nairobi, we have, in a sense, allowed ourselves to work during the day, with some restrictions in the sense that we have a curfew in the evening, and again we have the public health advisements that we have concerning washing of hands, or using of sanitizers. Using with this kind of advisements and regulations, indeed, certain people can actually go back to work, social distancing also being in place. And it's quite understandable. Sitting at home and not doing much, again, has the mental aspect to it, leading to a lot of stress, and anxiety. The other aspect is the economic aspect that the COVID-19 thing has brought to the world at large. Everything is a standstill, and people are not doing business as usual. I mean, the commerce aspect is really affected. The aspect of work, again, is also affected. So I think people are trying as much as possible to see to it that they're doing something within the parameters that can allow them. And basically, I think that's what's going on. People are trying to make do or with whatever is available.
All right, I think that's a very interesting concept. One of the things that I think is bringing out this behavior is because we have had many people talk about certain aspects or certain regards as far as the infection is concerned. Some people, are now saying that as long as you have had malaria in your past, you probably don't need to be concerned about it, or you can just gargle some salt, or you can pass some normal saline in your nose and you'll be fine. So I think there's a bit of misconceptions, a bit of myths that are going around, and I'd like to give you this opportunity to just go ahead, talk about all those things that have caused people to almost get back to normalcy, despite the fact that there's been quite, some grave information passed on by the government as far as behavior towards COVID-19 infection is concerned. So please take the stage.
Thank you so much, Richard. Well, I'm briefly going to share on debunking myths and misconceptions on COVID-19. As Richard has introduced, yes, I'm a medical doctor with also a public health specialist. In regards to the myths and misconceptions, I'm briefly just going to give an introduction on COVID-19. I know we have had quite a bit concerning COVID-19, but I'm just going to give a brief introduction to it before we tackle on the myths and the misconceptions. Well, COVID-19 is an infectious disease caused by the virus, severe acute respiratory coronavirus 2, which is a zoonotic infection, meaning that there was a spillover from animals to people. And it's part of the coronavirus family, one of them being the severe acute respiratory syndrome. The Middle East Mark in Saudi Arabia in 2012. The COVID-19 is believed to have originated from birds and snakes. You know, it's a normal flora. The virus is what we call a normal flora in this particular species, the birds and the snakes, and it's believed that it was passed on to a rare type of birds, the pangolins, which are believed to be illegally trafficked in China for food and medicine. And in Wuhan, in the open air market, it's believed that we had that spill over from animals to human beings, and leading to the COVID-19 infections being introduced to human beings. So statistically, as of today, we have about 3,849,136 confirmed cases globally, and about 265,929 mortalities reported. The recoveries of 1,317,092. In Kenya, as it were, we have about 607 cases total, about 197 recoveries and 29 mortalities. As we understand, transmission is from person to person and occurs when an infected person either sneezes, coughs, talks, and we have this infected small particulates or droplets from one getting to another. And when they attach in these surfaces, such as namely the mouth, nose, and eyes, they travel and get to, when they touch themselves to a cell, the viral particulate then attaches to the cell, gets to replicate in the cell, and therefore infects that person, and therefore keeps replicating until it affects the lungs and basically the airway. That's where it mostly affects. And we understand that these droplets cannot travel as far as more than a meter. However, it can also remain on surfaces, inert surfaces, for about 3 days, and it could even stretch up to about 9 days on inert surfaces. So that is why the public health advisory has been to keep the social distance, to wash our hands regularly, to clean surfaces, or use of sanitizers, you know, on our hands if we do not have soap and water, and cleaning on surfaces with disinfectants. So we understand that. Symptoms can occur between 2 to 14 days on exposure. This is the incubation period, which can stretch up even up to 27 days. But the mean has always been about 5 days. So symptoms can when someone has been exposed, so 2 to 14 days, that is the incubation period. The symptoms can range from being mild to severe. Those who will probably be infected and still be asymptomatic. By asymptomatic, I mean they would not show any of the signs and symptoms. Those that will be quite mild, all that they have probably would just be a sore throat or a running nose, you know, flu-like symptoms. Those that will have severe form of the illness, which could even lead to things like pneumonia, difficulty in breathing, shortness of breath, you know, leading to other complications. So by and large, these are the most common signs, or I mean, these are the most common symptoms that one can have after being exposed or infected by the virus. Fever, cough, running nose, sore throat, headache, and shortness of breath. Well, let's get to it on debunking the myths and misconceptions. Well, one of the myths or misconception that we have is that everyone who is infected by the virus will indeed die. The WHO clearly has reported on this and says that 80% of those that are infected will only have the mild form of the infection, and another about just well above 1% of those that will be infected will actually be asymptomatic. But largely, we have seen even within our jurisdiction or in our community, most of the people are actually asymptomatic per se. Um, that has been shown by the fact that in the recent past, when we have had the mass testing going on in certain areas like the Old Town Mombasa and in Isili, where we had the mass testing, most of these people were actually asymptomatic. They didn't feel any form of illness. They didn't have the flu-like symptoms. But once they went through the testing, they were deemed to be positive of coronavirus. And indeed, this shows that you can be infected, yes, but it is not a death sentence, as it were. It doesn't mean that everyone who gets it will has a death sentence laid on them. The disease in itself, those that probably are quite much at risk are those that the elderly and those that have an suppressed immune system, what we call the immunosuppressed people. Those that probably are much more elderly, above the 60 years, those that have other conditions such as diabetes, hypertension, cancer, those chronic illnesses are at risk of developing a severe form of illness. And once you have that severe form of the illness and you need specialized treatment, coupled with the other illness and indeed having a compromised immune system, therefore you become much more at risk of mortality, but does not necessarily mean that one will die after contracting the virus. So not everyone who actually gets the virus dies. The other misconception is that only the elderly and the younger ones are at risk. This is a misconception. We understand that all age groups can contract the causative agent, the severe acute respiratory coronavirus 2, which is the causative agent, the causative agent virus for COVID-19. Like I have alluded to before, that the elderly and those that have pre-existing medical conditions are likely to develop the severe form of the illness, but does not mean that they are the only ones at risk. Everyone is at risk in contracting this particular virus. The other misconception or myth that is also going around is that garlic can protect one from coronavirus. Indeed, this is a myth. Although garlic has been shown to slow down on some species of bacteria, coronavirus or severe acute coronavirus is indeed not a bacteria, it is a virus. Therefore, there isn't no evidence to suggest that garlic can actually protect one from a virus. Garlic indeed is a good antioxidant. It's good in as an antioxidant. What it does, it helps to boost your immunity, right? And reduces on what we call free radicals in the body, which would probably reduce or reduce in your immunity. That having said that, it doesn't mean that it will actually protect you from the virus. It's just a good antioxidant to your body and helps your body to helps you to boost your immunity, but not necessarily protect you from the virus, as it were. So that is a misconception there. Okay. The other one is drinking of ethanol, or methanol. Methanol is not it's not one that we drink. The alcohol that we drink is ethanol, not methanol. Methanol, it can be used in other disinfectants or bleaches or such kind of cleaning products. And this is a myth. It does not cure coronavirus disease. These substances can be used in cleaning products to kill the virus on surfaces. However, they shouldn't be drunk. Ethanol, which is used in alcoholic beverages, does not cure the virus when ingested, as it were. And we understand that excessive use of alcohol or drinking of alcohol could cause other health problems. So drinking alcohol or ethanol in moderation is okay, but in excess, well, it has caused problems to the liver, to the gut, and also mentally in things to do with um, being hooked to alcohol, so all these things, as it were, can cause problems. But ethanol in itself, or methanol, or bleach, these are not substances that cure coronavirus disease. Another myth that has been going around for a very long time is the issue to do with 5G network. There are a lot of conspiracy theories, as it were, that have been around for quite some time now concerning 5G. That the claim has been that the 5G actually propagates the virus in areas that the 5G has been installed. Experts worldwide have disputed this theory. And we understand with the other viruses, we also have other viruses like the flu virus, they have not been propagated with any form of technology such as 5G or 4G, as it were. So this is purely a myth, and there has been no scientific proof whatsoever that the electromagnetic signals can actually propagate the virus and spread it over, So Wuhan, which is one of the first cities to have installed the 5G in China, it's where the virus began, and understandably, this propagated this myth quite heavily because of that particular aspect of having Wuhan to be the first city to have had the outbreak of coronavirus. However, other cities in China, such as Beijing, Guangzhou, Shanghai, have all rolled out the 5G, and they didn't have that outbreak at first. So they were not the first cities to have the outbreak. The outbreak came about after people from Wuhan visited these other cities. So this is a myth, as it were. Other European countries as well, including Italy or the United Kingdom, have rolled out the 5G, but all the infections that brought out the outbreak in these cities, in those countries, could be traced to tourists who had actually traveled to China and other parts of the world that had the outbreak before those particular countries. So this is a myth. Well, the other aspect that is a myth and quite a myth and a misconception, as it were, is exposure to sun and high temperatures. Well, when the outbreak began, when the pandemic began in China and in other European countries, it was believed that because of the low temperatures in those areas, that this particular infection was propagated because of the low temperatures. However, when the pandemic had the outbreak in Africa, first in Egypt, where we understand the temperatures are quite high, this definitely threw out that notion or that misconception out the window. Anyone can actually be infected by this, no matter where they are, whether it's in a cold region, whether it's in a hot temperature region. All we have to do is protect ourselves, because once we understand how this particular virus is spread, from person to person, then we can do what the public health specialists and health workers are advocating on cleaning of hands. We're using soap and water. If soap and water is not available, we use hand sanitizers of alcohol base of more than 70%, avoiding touching our faces, that is our eyes, nose, and mouth. Again, using of face masks when we are in public spaces, especially in areas where, social distancing is an issue. Again, also coupled with also social distancing, these are measures that we can put in place to help us mitigate in spreading the virus, as it were. So exposing ourselves to high temperatures or to the sun does not prevent coronavirus disease. So this is a myth. Right. The other aspect is once you're infected with the COVID-19, that you'll have it for life. This is not true. Well, in our setting here, when one has been had the chance to have the test done on them and found out to be COVID-19 positive, they're put under quarantine for a period of time of, let's say, 14 days. During that time, this is a viral infection. Therefore, at this time, we do not have a specific drug that will actually take care of the virus, to kill the virus, as it were, in our bodies. But our bodies have a way our immunity has a way of fighting this particular virus and to subdue it in our body. Therefore, it means that we can recover. Once you have a good immunity, you can recover from this particular virus from your body. So with supportive care, if there's need, if they have a severe form of illness, they will need some specialized care. If it's supportive oxygen therapy, then that's what they'll get. If they have difficulty in breathing and they need to have ICU care, then probably they'll put on a respirator and all that. If they have a superimposed bacterial infection, that will be treated, but by and large, our immunity is able to fight the virus and recover. So once has recovered from it, you're free. The other thing that we do understand is that you can have a reinfection of COVID-19, even though you were infected or exposed to it once, doesn't mean that you are free from it completely for life. And these are things we're still learning as we go by, because this is a new infection. So there have been instances where people have had a reinfection of the virus, but does not mean that one will just have it for life. So that's basically a myth. The other thing is rinsing your nose with saline or gargling saline solution. Saline solution just means it's a salt solution, salt and water solution of a certain percentage. It's quite high. Let's say it's just salt and water solution. So rinsing your nose or gargling this particular saline won't prevent you from the coronavirus. No. Well, it could act like a mouthwash of some sort. Yes. It could assist probably in clearing bacterial infections. Yes. But viral infections, no. But and too much of doing this again could actually corrode the pharyngeal aspect, the ENT region. So doing too much of this again could also corrode those surfaces, because the lining of them are quite delicate. So using too much of this saline could actually corrode. Well, we use saline especially in people who have blocked noses, have an irritant throat and all that because of an infection, often not bacterial infection, and it kind of suits. But doing too much of this again could also corrode. And it's a myth in the sense that it does not kill the virus. Even when one has been infected by the virus, it does not prevent one from getting the infection. It doesn't clear the infection, as it were. The body has to fight the virus on its own.
I think that's a very interesting topic, Dr. that you raised. I just wanted to highlight to everyone, we have a Q&A question. And if anyone has a burning question that you'd like the Dr. to address, you can go right to the top of your screen. You'll see the Q&A, and you can type in so we can address some of the questions as we go ahead. There's someone who asked, do we have people who don't show the signs and symptoms for corona, but they just drop and die of the virus? It's very interesting because this is something that's been reported in Tanzania. Maybe some of you might have followed that story. I don't know, Dr. Do you have any comment on that?
I lost you there. Could you repeat the question, please? Hello, Richard.
Dr. Can you hear me?
Yes, I can hear you. I had lost you quite a bit, so I was asking if you could repeat the question.
All right. So, there's someone who asked, and I thought this was a very interesting question. Do we have people who don't show the signs and symptoms for corona, but they just drop and die of the virus?
Well, that is an interesting thing. In our society here, I don't think we have had such instances. And while over, we've had that kind of mass hysteria, as it were. Let me say this. Indeed, you see, this is a viral infection, and it's not that it just gets it infects one, and within minutes one gets to die. There are certain aspects that we need to look at. For example, we do not know the circumstances under which those people who were found to be dead in the streets, whether it was due to coronavirus or not. These are unsubstantiated claims, as it were. Until and when you are able to substantiate that claim indeed that this was coronavirus that caused this person to actually collapse and die, there are certain things that need to be done. And you see, we are not able to verify that particular aspect. In our society, as we are, in our jurisdiction, as we have seen, even with the people that were found to have the coronavirus and they were asymptomatic, they didn't feel anything. They didn't have any. Asymptomatic just means you have no symptoms whatsoever. And with the mass testing, it has proved that yes, indeed, in our community, we have those that are symptomatic and still have the virus disease, and they're moving around not knowing that they have the virus. The aspect of now people collapsing, it could be due to other illnesses. Someone could have had low sugar, have diabetes, and they were not well managed and they collapsed. Someone was hungry. And there are lots to discuss concerning just people dropping down dead and just attributing it to coronavirus, which might in itself just cause some panic in our society, but might not be necessarily true. So it's quite hard to just pinpoint and say, yes, that is happening, or no, that is not happening. It will take us time to actually substantiate these claims, as it were. But in our society, like in Nairobi, what we have seen, that is not happening. That is not happening.
I think that's it's a very fair response, because I see someone else asking, other than the flu symptoms,
yes,
are there any other signs that would show you, or that would be associated with the COVID-19? Because then you wonder, if there are specific signs, then and other people are just probably just falling off the planet and dying, are there some other symptoms we need to be cautious about?
What we need to just understand is the most common symptoms that we have are the flu-like symptoms. Yes, indeed, since it's a virus, there are other symptoms which are not common that can occur. For example, one can have a loose stool, a diarrhea kind, because it's viral. It can affect the GIT. So these symptoms are not really specific to coronavirus disease. Having said that, is to just advise us that if we are unwell, all we need to do is seek medical help from a doctor in a hospital, and once they are able to get your history, if you have been in contact with someone that has had the flu-like symptoms, or someone who's had the coronavirus disease. You see, these are certain things that will actually help the doctor to ascertain whether you have the virus or not. And then once they also do the test on you, they will be able to know whether indeed you're positive for coronavirus or not. You see, the thing is this, propagating fear amongst us and anxiety will not help the situation, as it were. What we need to understand is how the virus itself is being propagated or being spread from one person to the next. Adhere to the public health advice on protecting yourself from getting the virus. And if at all you get the virus, understand that most of the people actually have a mild form of the infection. Some of us will always as well just be asymptomatic, as it were, and our bodies are able to fight this particular virus, and we're able to get better even after being infected by it. So the issue I'll keep repeating this and saying that in our jurisdiction within Kenya, within the areas of the outbreak there has been, for example, Nairobi, Mombasa, Kilifi, we've not had those instances of just people dropping dead in the street, therefore it would be irresponsible of me to say that this indeed does happen, and coronavirus can cause that, because it's a respiratory tract infection. Yes, some of the people who have other respiratory infections, respiratory diseases such as asthma, might have complications when they have coronavirus disease, because it affects their lungs. But does not necessarily mean that these people can actually just drop dead at once and without, just like that on the streets. Well, Richard, I hope that helps.
Yeah, I think that does help. It's a very interesting topic, because there's someone who has asked a very interesting question, and I'd like to just bring it back home just a little bit. And I want to talk about the Kenyan situation we currently have. Now, I don't know if most of you have walked into the malls, or even if you walk maybe probably on the streets, you will see that, yes, someone is carrying a mask, but the way that mask has been placed on the face is not proper. Someone is placing the mask on the chin, or is just placing it in a place that's probably on the forehead.
Yes.
And some people have questioned whether this virus is actually with us, because if you look at how people are behaving in terms of protecting themselves against acquisition of the virus, it goes to show you that probably we're not doing as much as we should. And the cases, or the number of cases that have been reported, have not been, we've not had an incline as compared to what the Western European countries have experienced. And there's someone who asked, is it possible that the African race has some form of immunity? And I think this might be related, because then again, when you look at the Kenyan situation, where every child that's born has to get a BCG vaccination given, is there any correlation between that? Is there some form of protection that you get from that kind of injection? But then there's also someone who says that there was some form of, can I say, prophecy that Africans will die in their thousands very soon. I don't know whether this is something you've heard, or if there's anything you'd like to comment on that.
Let me just start on how people are using the face mask as a fashion statement. On a light note, putting the face mask on either their forehead and or below the chin. It's really uncomfortable staying with a face mask for a very long time, especially now in our society, where we are used to being free. In some way, it makes you feel like as though you have been restricted. Well, it's indeed, it's true. It feels like we have been restricted. I cannot deny that. But again, once we understand how the propagation of the virus is, the face mask in itself cannot protect us. In itself alone cannot protect us from actually acquiring or getting infected or being exposed to the virus. The other aspects that we've talked about, like social distancing, have to be put in place. Okay. The other aspects of washing our hands with soap and water, or using sanitizers. So, indeed, when we go to public spaces, that is when that we are much required to put on this face mask. The thing is to reduce or to mitigate the risk of actually spreading or contracting the virus when you're outside there, where we are unable to control as much the social distancing as it were. You know, when you're in a private setting within a room and all that, in somewhat way you're able to structure the social distancing. But when you're outside, say in a mall and all that, by and large, it's very difficult to do the social distancing. And therefore, that is why the public health are advising, or medical practitioners are advising that, yes, when you go outside in an area, let's say in a mall, in a public space, as it were, then you wear the face mask. This is just to reduce or mitigate on the propagation of the virus, as it were. The other thing that we've talked about, have you say, is about the BCG. Yes, indeed, there have been speculation that areas where the BCG immunization has been taking place, that it doesn't seem the virus doesn't seem to be as severe as in other communities where the BCG was not being given. This is yet to be proven. So it's something that still has, there's still more research that still needs to go to it. In Europe, where there were kind of, what is the word? Comparing Europe and Africa, where in Europe some of the countries are not doing the BCG, like Italy, where we had people dying in their thousands. Well, it was thought that this virus actually did affect them that much because of their demographics. This is what I mean by the demographics, that there are a lot more elderly people in Italy than the population that we have in Africa. In Africa right now, the population, much of the population are actually the youth. So we have that disparity in how so many people died in Italy or in Europe because of that demographic difference. The prophecy, or quote unquote, as it were, that Africans will die in the thousands. You see, this is a viral infection. We have had other viral infections in Africa. This might be basically just my personal opinion. It doesn't necessarily need to be very scientific, as it were. We have dealt with so many other viral infections, from Ebola, HIV/AIDS, polio, we've had all these kind of viruses moving around in Africa, and so many other infectious diseases. And by and large, we have in a way developed certain measures within our healthcare system in mitigating on how these infectious diseases have been ravaging us. So I don't believe that we are going to have that impact of that was witnessed in Europe, as it were, where people are dying in their thousands. Not that because we are such immune to this particular virus, but because we have been in an environment where our bodies have always been ravaged with other infections. Therefore, our bodies are much more accustomed in fighting infections. This is my opinion, please. And I think in as much as we are going to see probably infection of the infection rates going a bit up, I don't think we are going to see a lot of mortalities, as it were. This is basically the thinking, that we have been in a situation where we've been ravaged with a lot of infectious diseases, that our bodies are quite adaptive to fighting infections. So I think that's basically my opinion here on that particular point.
Thank you very much for that. Allow me to be just slightly controversial here. Despite the fact that this COVID infection has come up, has brought so much negative vibes, so to speak. We still have some good stories going around. Yes. I'm sure most of us have spent a lot of time with their families, just trying to reconnect and, just build those bridges that have been broken.
Yes.
There's also been amazing stories from all over Africa, and I want to touch on Madagascar, which, has been on the map. And the WHO was even considering thinking about uh, taking a very significant move towards the herbal cure that they purport to be a treatment for this infection. I don't know, is there anything that may make us look towards that direction as far as treatment or prevention of this infection is concerned? What is your opinion on that?
My opinion would be, I mean, we can try anything and everything, as it were. Right now, this is a new infection. We don't know as much as we should. Even in regards to, I can take you back and just let's compare with HIV when it came. When we had HIV in 1984, the first time in Africa, it was said that yes, indeed, people will die because there was no cure to it and all that. But as the decades went by, as time went on, much more was being understood about the HIV virus. And right now, actually, we have medication that can actually protect one from actually acquiring the virus. We have children who have been born out of a union of those that are HIV positive and the children are HIV negative. So right now, I wouldn't say that we should restrict ourselves from trying anything. I mean, all these medications are from the herbs. I mean, they have just been refined, and we have understood how they're being used, how they work in our bodies, and in what quantities do we require to have them in us, so that they can actually take care of the virus and not harm us. So the thin line is between when taking a medication or developing a medication is knowing how much you require to clear the disease, and it will not affect or negatively affect the person who actually takes it. So I wouldn't say that just dismissing what Madagascar are doing on their herbal medication would be right. But again, it is somewhere that we should tread carefully, and not just be over the moon about it, but study it, see how it goes, and see what it does, and probably we might have something hopeful and something to take care of coronavirus, and finally from Africa.
I think that's a really good point, Dr. When you were talking about developing immunity and just talking about how creating some form of immunity, especially because Africans, or the way our social economic status is defined, we have gone through so much in terms of interacting with viruses, bacteria, and all sorts of disease-causing microorganisms that we've developed some form of immunity. I wonder what you think about, these long or lengthy periods of isolation, or could I say quarantine? There's one of the attendees who's asked a very important question. Do we, by some form of way, reduce our immunity by preventing or reducing our association with other people, and therefore preventing or reducing our interaction with the microorganisms that might eventually give us some form of immunity? And eventually, are we then preventing herd immunity from taking over and getting rid of this infection? What do you think about
That's
that?
a really controversial point. That's a very controversial question, and answering it as a yes or no would be quite difficult. Yes, indeed. Just staying at home and not interacting with people, not interacting with the environment, as it were. It's a theory that we have in the medical field, of what we call the hygiene theory, where one person is probably brought up in an area where it's very hygienic, in the sense that when they're brought up into the real world, they are unable to cope with the viruses or the microbes within our environment, because we understand that everywhere. So they're in the air, they're in the dust, they're in the grass, they're everywhere. So having this kind of the theory of the hygiene theory basically just means when you live in a very hygienic space, then in somewhat way, your body is unable to develop some sort of stamina to combat the microbes that might be around us. She has a point right there. However, within this period, now that we haven't learned so much, you see, we cannot just drop our immunity within a very short period. It's not right to just say that even though we're in isolation or in quarantine within this period, that our immunity is just going to drop just like that. Understand this: we still have what we call the normal flora within us. Even amongst our family, we still have that normal flora, the microbes, as it were. So our bodies still have that immunity against such. So in this particular period where we are doing all these hygienic practices, it's just to mitigate or to reduce the risk of contracting this particular virus. But in my opinion, I'm seeing a world where we will definitely get to a point where we will get to understand much more about coronavirus. Much more of probably the populace will have gotten the infection, and as it were, now we will not be looking at much more of just halting or spreading the virus. Probably will now be looking at those who are in severe cases, or severe form of the infection. That is where I'm seeing us going into, because initially when the outbreak began, what we were trying to do was, you see, there are stages of an outbreak. You have the outbreak, then you have local transmission, then you have community transmission. And in an outbreak is where one person brings in the infection in that particular zone. For example, when we had the first case in Kenya, then that was an outbreak for us. When we had a local transmission is where we had that particular one person spread it to a local here, and we were able to stress it to that particular person. And this local also transmitted to another local person. We have a local transmission. But when we get to a community transmission is where we are unable to actually trace someone to trace where one got this infection. And you see, by and large, in as much as we are trying not to go to the community transmission, we are definitely heading there. But once we head there, it means that much of the populace will now have gotten the virus, to the extent now what we need to take care of is the people that have developed the severe form of the infection. And I think by that time we'll have understood much of the COVID-19, what it is, how this virus much affects us, how can it be dealt with, and by then, much is still going on, even in developing of a vaccine, trying to see, developing protocols on treatment and all that. Yes. So I think, by and large, we'll get to a point where we can also develop what we call the herd immunity. So, as it were, for now, we just have to do what we need to do, support what the government and the medical professions are telling us. But by and large, these are things that will come out as time goes by.
All right. Thank you so much for that, Dr. Now, I think we are having quite some interaction on the Q&A. I encourage as many people as possible to post any questions or any views that they'd like clarification now that we have Dr. online. Dr. I think you can go ahead and just continue with your slides, and we can come back and talk a little bit more about the questions that are coming on my Q&A.
Okay, Richard. Well, I just had one more to talk about, and I think one of the myths that we need to debunk is on antibiotics. Are they effective in preventing and treating the new coronavirus? The answer is unanimous and magnanimous no. This is because the coronavirus is virus. It's not a bacteria. Antibiotics treat bacterial infections. So should one have a core infection of a bacterial infection, then the antibiotics may be effective, but not to treat the coronavirus, as it were. So it shouldn't be a means of preventing or treating the virus. So the other myth was on the outbreak began because people ate a bat soup. Like I'd mentioned, the virus is believed to have spilled over from bats, but there's no evidence to show that when you ingest these bats or those snakes, that then you get the infection of the coronavirus. No, so this is a myth. This is a myth. it did not come about by people having eaten either bat or a snake or soup or any form of those delicacies in those regions. Yeah.
All right. Thank you very much for that, Dr. There's a couple of questions that I've seen on the Q&A, and one of them that I'd like us to address, which I think affects most of us, is really regarding the masks that we put on.
Mm-hmm.
Now, most people have been putting on kitenge masks. These are just masks that have been made of cloth.
Yes.
And some people have gone ahead and they've asked, because you're literally covering your nose and mouth, what about your eyes? Are these masks effective? How long does a virus that last as form of droplets? Is it really helping us? Is it even safe for children who are under 5? Could it lead to suffocation? So this is something that we do often, because if you were to go to a shopping mall, they would not let you in if you do not have a face mask. So is it working in our favor? Is it not? What is your opinion on this?
Well, the opinion is this concerning face masks. See, face masks, we have the WHO and the CDC were actually advocating that face masks should be used by the health workers in hospitals. The other people that were supposed to use the face mask are those that are infected by the virus, the coronavirus disease. The other people that were to use face masks are those that are involved in taking care of the sick. Okay, so but in regards to areas where we have community transmission, like I alluded to, the various stages of the outbreak, in community transmission, to mitigate the risk or to reduce the risk on spreading the virus, then it is advised that when we get out to public spaces, then we get face masks on. This is one to mitigate just the risk of spreading the virus, because we understand how it is spread. It's through talking, coughing, sneezing, So we are covering the face and mouth for that particular reason when we are going outside in public spaces. And this is the reason also being that in public spaces, we are unable to as much to control the social distancing, because we understand how the virus is being spread by, it's being emanated into the air onto surfaces. It's by talking, coughing, sneezing. So just using the face mask alone, that would be a myth that it would protect you, as it were. You also have to use all the other measures that have been put in place, washing of hands, sanitizers, and social distancing. So that is the logic behind us using face masks when we go in public spaces. Richard?
All right, thank you for that. Now, I want to go a little controversial again here.
Mm-hmm.
I wonder if you saw this clip that was posted by one of the presidents of this region, and in that post on social media, he alluded that it's possible that the test kits that they were using were accurate.
Were not accurate.
Exactly, or rather, they have been tampered with. Some form of sabotage. There's been similar conversations in Canada and in some other parts of the world.
Yeah.
And I think even coming closer home in Kenya, we had a very close call where people were of the opinion that the kits that had been used in some parts of the country were not accurate. So this begs to ask you now, how is it possible for us to ascertain that the tests or the test kits that we have are giving us accurate reports, and that we are not chasing wild goose here? Is there something that can comment on that?
Well, this is a very good question, and I think is I may not be at a very good position to give a very substantive answer for that, but my opinion would be this. Indeed, with this particular COVID-19, my opinion would be that this mass testing or the testing of this of any kind, where we are probably not seeing this test kits being provided, not being reliable, and in essence, questioning their validity will definitely cause a lot of fuss. My opinion would be that well, the government has to do what it does. We need still to be tested. Uh, we still need to have faith in Ministry of Health that the kits that they're using are actually valid and the kits that they're using are reliable. Up to the time when probably investigations done to these claims are actually verified, then it's very difficult to say whether we are chasing after wild goose or chasing after wind. But in my opinion, this is personal, not as a doctor, but as a person, a personal opinion for me. I would think that for now we should be focusing mostly on those that have severe cases of the disease. We, as it were, we cannot control the spread of this. In this sense, it is already in the community. It is already in the community. So in as much as we want to find out how many people have been infected, we will always fall behind the rate of the infection, as it were, because what we are the numbers that we are getting are far much behind the actual real numbers that are in the community right now. So in my opinion, I would personal opinion would be that we need to be focusing on people that have the severe cases of the infection and treat those as such. Because remember, when we had uh, the HIV unwell with the virus. That was our main focus, and we moved that focus and propagate and asked people to prevent themselves from getting the virus. I think working in hand both ways, we would make much progress than just trying to do the mass testing to find out how many people have been infected by the virus. I don't know if that makes sense.
That actually does make sense. And there's something I think I wanted you to highlight. Now, most employers or most of us are probably working from home. And we think most of the employers have been able to make arrangements, but we also understand that there are some people who may not really be able to entirely work from home, and therefore they've been making trips to and from home. And at the same time, we still have people who are going to shopping malls to buy things to use in the house. And I think this is a question, or this is a query that affects basically everyone. Now, when you step out of the house, you literally walk into an infected area, so to speak. There's viruses, they're supposed to be viruses all over. That means you will not only have them come to your mouth or nose and eyes, but they will also probably attach to your clothes, to whichever surface that they can. So I think probably it's a good idea for us to think about, what would be a recommended procedure, or some form of protocol that we can put in measure, especially when you've been away from home to go to work, or probably go to the mall, and then you come back home. What should you do? What are some of the things that you can do to prevent accidental infection and accidental spread of the virus?
Well, the basic things that we'll probably do. One of the things is that once you get to the house, after that, being in an outside, in an open air area, or being at work, having contracted with a lot of people, then when you get home, it just means you'll have to take off those clothes. take a shower, put on new clothes, and the clothes that probably you are wearing would probably need to be soaked in soap and water, or put in a different bin where they will be washed later. And just those routines that we normally have, such that we do not come into close contact with those that are at home. Once we are from outside, we just go and change, take a shower, wash your hands. Those simple things are the basic protocols that we can probably have. We can't put too much restrictions, as it were. We need to be a bit flexible, but again, cognizant of the fact that this is how viruses spread. So those simple things like just washing hands, sanitizing your hands, taking a shower, changing your clothes, are the simple things that we can do.
All right.
There's a particular question that someone asked concerning face masks for children. Face masks are not recommended for children from the age of 2 and below. And remember, when you're using face masks, use face mask when you're going outside the house. Okay. Again, if you're going outside the house, probably with a toddler, just ensure you have that social distancing. That those below 1 year, you can't put face mask on them. Just ensure that you have that social distancing, and probably the caregiver would be having a mask when they're going out. Those simple things. So wearing masks for children under the age of 2 is not recommended at all. Someone was asking here again if there's a risk of hypoxia when wearing a mask with the nose and mouth with extended periods. No, not at all. Because hypoxia just means that you are not able to get oxygen into your body, and that's not true. When you're yes, Richard, you can go on.
All right. I think because I think we've captured almost all the questions and all the queries that we've had on the Q&A.
Yes.
I'd like to just thank you so much for spending the last 1 hour with us, and especially thanking the people who are able to also get some time off and join in this conversation. As Zamara, we are going to be organizing such webinars to talk about some of the effects or how the COVID-19 infection has affected us as human beings in our places of work, at the places of our residence, and generally in terms of our psychosocial being. We will have interesting sessions, not just topical, but also issues to do with taking care of yourself in terms of fitness and exercise, and much more to come. So look out for our invitations. We thank you so much for taking time, Dr. And thank you to everyone else. And would you mind just giving your final comments so we can officially close the meeting?
Well, I would like to thank everyone who participated in this webinar. And let's keep safe. Let's keep sanitizing. Let's keep the social distancing. But above all, let's get the credible information concerning coronavirus. But by and large, let's keep safe and let's keep trusting God. Yes, that's it.
Thank you. I think you heard it from Dr. Let's adhere to what the government stipulations and guidelines as far as prevention of infection is concerned. And God bless and keep safe.